Dance Arts of Columbia provides fitness fun for everyone from 3 years old to adult. Dance Arts is a good environment where the friendly staff makes you feel comfortable. Dance Arts feels that dance is an art form that you can experience firsthand by learning tap, jazz, modern, musical theater, lyrical, and ballet. Dance Arts urges you to enjoy a sense of accomplishment while getting fit and having fun. For class information, call 875-1569. Dance Arts of Columbia, serving Columbia since 1979.
Good morning and welcome to Radio Friends on Monday, September the 28th. We're just about through this month, which is hard to believe.
Yeah.
How fast time goes by.
September faucet on, and it's really
I've not heard that before.
Yeah.
Somebody left the September faucet on and it's run out.
Yeah.
We've got Heather Harlan here, Phoenix Health Programs. Good to have you here, Heather.
It's always good to be here.
When you walked in today, you said, I'm so glad I'm here because this is National Recovery Month. And even though we're at the end of September, it's still National Recovery Month.
We've had things going on in Phoenix this month. It is National Recovery Month. It's to observe mental health issues and substance use issues, disorders, that people recover from that. So
by substance, you mean alcohol and drugs?
And drugs, yes, and other drugs. And so that in Recovery Month, we're celebrating that we observe that behavioral health is vital to overall health. Mm-hmm. Prevention works. Treatment is effective. People can and do recover. Mm-hmm. And so we really kind of begin to focus on those messages to bring that. A lot of people who have recovered are kind of invisible. We don't know.
Right.
So we think
it's not something that a lot of people go bragging about.
Yeah. So what I want to share today, and I'm so glad to have some time to discuss it, is that in treatment, a lot of people associate the 12-step model, for example, what they use in Alcoholics Anonymous or Narcotics Anonymous, that's treatment, and overwhelmingly that's what you would get in a treatment center in the United States. At Phoenix, we do something a little different, and we so appreciate support from the 12-step programs, but we do something that's a little bit different. I kind of wanted to go over some of those ideas as to how we approach it different.
I have always heard that if you're an alcoholic or you're a drug addict, that before you can get treatment, you gotta hit rock bottom. I've heard that forever. You gotta hit rock bottom. They won't get treatment until they hit rock bottom, and then they realize that, okay, it's time to do something. Is that true or not?
What we're finding, the research tells us, is we see it a lot different. What we believe and what we see, and the research backs us up, is people can begin to make positive choices and begin the process of change anytime.
Before they hit rock bottom?
Before they hit rock bottom. Sometimes there's pain involved. But we as a community and we as treatment professionals can do a lot to begin to make recovery look much more inviting. So people really don't have to, and I really hope everyone who's listening today or who's watching will hear your loved one does not need to lose everything. You don't all have to go through that. So give us a call and we'll give you a number at the end.
You don't have to hit rock bottom.
No, you can begin to make positive choices, and what you do can make a difference too.
But here's something.
Okay.
A lot of times when people are addicted to alcohol or they're addicted to drugs, they won't admit that they have a problem. But yet the loved ones can tell that there is a situation here that's not healthy. How do you convince somebody that you really care about that they're drinking too much or they're hooked on drugs when they won't admit it themselves?
Well, what we look at is, again, the recovery community, the way we're different is the recovery community might say, well, they have to be ready. Like, they have to admit it. And what we're saying, change is a process. And that we, again, as professionals in treatment, we have motivational techniques to help people begin to move through that process of change, where they begin thinking about it, maybe before they admit anything, before they see or understand anything. So we see, instead of saying, they just have to be ready, we say change is a process, it's not an event, and we can help you and your family begin to move through that process, take small steps in a different direction. We also see in the recovery community, and you may have heard this too, again, that you got to use the 12 steps, which begins with admitting we were powerless over alcohol and our lives have become unmanageable. Many, many people, I know some, you probably know some too, have found recovery using those steps. At the same time, we also know a lot of people that wasn't a good fit for them for recovery. They didn't use the 12 steps. So we say some people do, some people don't. We like to think of it as a buffet. That's an option, but we want to set some other food out on the buffet and other options on the buffet.
If you were an alcoholic, are you always an alcoholic?
That's a very difficult question. For people who may have a physical dependency, it may be that their brains and the neural pathways in their brains have changed sufficiently that they can never go back to drinking.
They could never even have a little drink.
Right. And so that's really a clinical decision that I'm not equipped to answer. So we've seen some people who simply can't, and then there's some other people. It's pretty complicated. Mm-hmm. But certainly, chemicals cause changes in our brains.
Yeah. This being National Recovery Month, there may be someone listening to us right now who has a family member or someone that they care for a great deal, that they know is having a problem. What do you say to them as far as how you can help them get help for their loved one?
Number one is get help for yourself. We have a family group, 6 to 8 on Mondays, free and open to the community. If you're taking care of yourself, if you're getting sleep, exercising, eating a good diet, finding things in your life you enjoy, you're helping your loved one by taking care of yourself. Self-care is the best way. So begin to do that and begin to get some support for yourself. And we know there are spiritual solutions that are offered. AA and NA would say the big book. You have to use what they call the big book of Alcoholics Anonymous. And we would want family members to know also there's medication-assisted treatment that might be available. There are medicines that can help reduce cravings and help reduce withdrawal symptoms. And a lot of times then in 12-step programs, it tends to be more find a sponsor and do what you're told. Which again works for many people, but it's not a good fit for everyone. So what we believe in treatment is the answers are in the individual seeking treatment. Our job as professionals to come alongside, listen, support, listen to what's valuable to them, and help them find the answers. We believe the answers are there already in them. We certainly encourage spiritual and community support, but the answer's already in there. But family members, it's important for family members to know you can begin to change. You do not have to wait on a loved one. And you can call us to find out more about how to do that. You do not have to wait till they hit bottom. They don't have to be ready. And if they say, I tried the 12 steps, I didn't like it, there are other ways we can approach them. They give us a call, 573-875-8880.
And you have every Monday night.
Every Monday,
it's free. It's
6
open
to
to the public.
Open to the public. Just come on down, except for Monday holidays, but just come on down. You don't have to register anything. Just come on in.
And so if you're dealing with a loved one or a friend or a family member that you suspect is having the problem, and they don't want to seek help, the first thing for you to do is for you to go.
Yes. And we're so focused on the individual. And we're trying to keep them from hitting bottom. Maybe we need to just step back and go take care of ourselves and find out what we can do to change.
What's the phone number to call?
573-875-8880. Phoenix Health Programs, and we're also on Facebook.
All right.
Thanks.
Heather Harlan, always a pleasure to have you here.
Thanks for continuing the conversation on this call.
Welcome.
We appreciate it. Happy National Recovery Month.
Yeah. We're almost done with the year. Let's see. Tomorrow, Bill Wickersham will be on with us. He's just back from Walk Back in Time talking about UFOs. See you tomorrow. If you'd like to listen to this again or watch it, kbia.org. Bye-bye.